5-Minute Pearls for Clinical Practice. This week's pearl is called East and West. Hello, this is Dr. Brian Morris, and this is 5-Minute Pearls for Clinical Practice, where you will learn the tools to provide exceptional care for your patients. This is the weekly podcast where you will be introduced to time-tested, evidence-based patient care strategies that aren't always taught in schools or training programs, but are nonetheless crucial for success in clinical practice. And each podcast episode is about 5 minutes. A common debate that I see in clinical practice relates to the fact that care is provided very differently in different parts of the world. In fact, care is slightly different in different parts of a single country. For example, here in the United States, different chemotherapy regimens are used for breast cancer in different cities. So a patient may receive a different chemotherapy regimen if she lives in Miami or New York City or Los Angeles or Chicago. Does this mean that certain cities know more or less about breast cancer? Not necessarily. In many cases, it has less to do with differences in effectiveness of treatments and more to do with different types of training programs and different experiences with various treatments. In this example, the success rates with the various breast cancer chemo regimens are fairly similar. Similarly, if we look internationally, we will see that treatments can vary from country to country. We like to think that Western medicine is the end-all of all patient care, but we are surprised when we see that so-called Eastern medicine can have a very successful rate of success in treating many medical problems. So how can we balance this discrepancy? How can we balance in our minds the fact that there is an Eastern type of medicine and a Western type of medicine? Well, to balance this, we realize that there are benefits to both Eastern and Western medicine. Living here in the United States, we learn mostly about pharmaceutical drugs and surgeries, and these treatments are crucial to patient care. From statins to chemotherapy agents to antibiotics, pharmaceutical drugs have been a lifesaver for so many people. Similarly, procedures like laparoscopies and endoscopies and modern cancer surgery techniques have all been lifesavers to many. So Western medicine is very important to patient care. However, we also need to stay open-minded about Eastern medicine and how treatments that we may not have learned about in school may still hold some benefit for our patients. We all probably have had patients who tried every sort of Western medicine and did not appear to have any options left until they resorted to some form of Eastern medicine and found good results. Optimal care is the synthesis and synergy of the best of Western and Eastern medicine. So how do we accomplish this? How do we practice in a way that provides our patients with the best of both worlds? We accomplish this by relying on good science. Being open-minded does not mean that we forget about good science. We are open-minded about treatments. We are open-minded about treatments from anywhere in the world, but we still rely on the science. Just because we hear about a certain treatment from another country as being successful doesn't mean that we accept that it is safe and effective. We look for and rely on good, sound science to either support or reject a treatment, whether it is from the East or the West. We let the science decide whether there is good, sound evidence that something could work for our patients, whether it is from China or from Sloan Kettering, Japan or MD Anderson. We still look at the science. We read the scientific papers on any treatment that we are considering for a patient, and we study those papers rigorously. Is there good evidence that something works? Is there good evidence that something is safe? Are there good, sound scientific studies that justify a specific treatment? If so, we're open to that treatment and would consider that treatment for our patients. If there isn't good science behind something, though, we wait for that science to be published. We make sure that we have thoroughly read and studied the scientific papers on a given treatment before we consider recommending it. We make reasoned judgments on the safety and efficacy of any treatment. And by doing this, we provide our patients with the optimal comprehensive access to the best of both worlds, the East and the West. Let's keep the dialogue going. Let me know what you think of this week's Pearl for Clinical Practice. You can email me at drmorris@5minutemd.com. That's DRMORRIS at 5minutemd.com. You can post your comments and your experiences on the 5 Minute MD Facebook page. You can follow us on Twitter at Brian Morris MD. And you can visit us anytime on our website, 5minutemd.com. Let your friends and your colleagues know about the podcast and make sure that you are subscribed on iTunes. When you are subscribed on iTunes, you will receive new podcast pearls as soon as they are posted. And if you have a few minutes and you enjoy what we're doing here on this podcast, please head over to iTunes and leave us a review. Thank you so much for listening. I will see you at the next 5.